We mention them in the chat box and if possible. The cardiac should be ensured.
ചെറിയൊരു നെറ്റ്വർക്ക് പ്രോബ്ലം ആണ്.
അതെ.
ഞാൻ ക്ലാസ് സ്റ്റാർട്ട് ചെയ്യാന്നല്ലേ?
സ്റ്റാർട്ട് ചെയ്യട്ടെ.
ഓക്കേ മാം.
ഓഡിയോ ക്ലിയർ ആണല്ലോ അല്ലേ?
ക്ലിയർ ആണ്.
കണ്ണൂരിൽ നിന്നാണോ പ്രക്ഷേപണം?
അതെ അതെ സർ. അത് കാരണം ഒരു ചെറിയ ടെൻഷനുണ്ട്.
അവിടെ ഒരു റേഞ്ച് കുറവാന്നൊക്കെ.
നെറ്റ്വർക്ക്.
അത് അങ്ങനെ എന്തെങ്കിലും ഉണ്ടെങ്കിൽ അങ്ങ് വീഡിയോ ആ സമയത്ത് അങ്ങ് ഓഫ് ചെയ്താൽ മതി, അന്നേരം ഓഡിയോ കറക്റ്റ് ആയിക്കോളും.
ഓക്കെ ഓക്കെ സർ.
സ്ക്രീൻ ഷെയർ അല്ല, വീഡിയോ. ഇടയ്ക്ക് വരുമായിരിക്കും, സാരമില്ല, തുടങ്ങിക്കോളൂ.
Okay, sir. Good evening, one and all. I sincerely thank all the good words and the inspirative welcome by Dr. Baiju Doctor and Dr. Sri Lakshmi. I feel I'm at home. Working with Dr. Baiju was a great experience. Even though he's my senior, he could give a lot of practical advice and he could guide me in many of my activities regarding the project on Snehadara. That's a project for the management of development disabilities in children. We are having a peripheral unit for managing these development disabilities at his supervision at Government Ayurvedic Hospital of VARKALA, and it's running very successfully. So thank you, sir, once more for the kind words and all the cooperation and guidance rendered in the throughout this period, sir.
Thank you.
And I shall start the vast topic. It is pediatric respiratory diseases. So I thought of we are all having a thorough theoretical background. So I'll be narrating only the practical aspects of these pediatric respiratory diseases. So if anyone having any query in between can share their doubts in the chat box, or I can directly ask. So there's a graph showing the distribution of respiratory complaints in typical general practice. You can see that common cold comprises of almost 59% of the pediatric illness. And the next comes bronchiolitis, next asthma, then influenza and all. And it comes GERD, COPD and all. So this upper respiratory infection comprises of almost more than 50% of these respiratory diseases. So having cough as the main manifestation. While dealing with a cough, it's a major complaint. Almost 80% of the patients coming to OPD will be having a complaints of either rhinitis or running nose or a cough. Maybe cough is the main symptom or cough is an associated symptom. We will find complaints of cough on examination. We are dealing with cases where cough is the main symptom or main complaint of the patient. It's usually, even though many types of cough is narrated in the classics, I'll go through only 4 types which we need to be highlighted. Dry cough, it's without expectoration, nothing to, no sputum is there to expectorate. It's dry. It's typically seen in pharyngitis, laryngitis and all. We can call it as Vadiga Kasa or Shushka Kasa. Vada is more and Kabaja Bhava is less. Then second comes productive cough. This is the most common one. Productive cough. Sputum is more. The patient or child is expectorating the sputum. It's producing, it's a wet cough. Patient is comfortably expectorating the sputum. Usually an infective or inflammatory phase is usually associated with this productive cough. So I will call it as a Paithiga Kasa with the Kapaja association. And the next comes paroxysmal cough. Usually it's an effortful cough by the child to cough out an entrapped sputum. The sputum may be entrapped somewhere in the lungs or a lower respiratory tract, but the airways are not so open that the child is finding very difficult to cough it out. Or maybe the sputum is very thick and tenacious, so that baby is finding very difficult to cough it out. It is usually seen in paroxysmal cough is usually seen in pertussis or whooping cough. Or if the baby have aspirated a foreign body or some peanut or something like that, the baby is trying very hard to cough it out. So paroxysmal cough, it's not oftenly seen. Then comes the nocturnal cough. It can be either dry or productive, but usually it's on the dry side. It's usually on Vadika nature. It aggravates with the cold climate, especially during night. So the speciality is it aggravates during the night time with excessive cold, usually associated with adenoid hypertrophy and also seen in bronchial asthma. So it's Vada Kabaja, or mainly on which is aggravated with Shita. Both Vada and Kaba gets aggravated. So it's Vada Kabaja type. So in nutshell, I'm classifying the Kasa. Dry cough is Vadika, productive cough Kapanubadha Pitta Kasa, paroxysmal is Avarana Kapha, and that nocturnal is Vada Kabaja. So we will deal with each one separately. This one is, I'm going to deal with Vadika Kasa first. That's a dry cough. Nothing to expectorate. Baby is feeling the dryness on the throat. It's usually triggered with cold climate and especially in the night. If the baby is consumed little bit of hot water, the baby will feel a soothing effect, especially if lime juice or something like that, baby will feel or a bit of lozenges, baby will feel will usually check for a constipation as an associated feature. Here the Sthanika dosha Kanda, the Sthanika dosha is Kaba and Agata dosha is Vada. So usually it's associated with hyperventilation. The baby will be having a mouth breathing attitude and the nasal obstruction will be there. So the hyperventilation through the mouth will be causing the dryness of the throat, and hence the dryness will be triggering a dry cough. That is perfectly Vadika Shushka Kasa. So Vadika Shushka Kasa doesn't have much pathology behind. No need to go for intensive kashayas or pungent kashayas. So while facing a pediatric practice, you have to bear in mind that while selecting the drug, palatability is also important. While in adult practice is not that much important. So better avoid this pungent kashayas, especially in Vadika Shushka Kasa, where Kashaya Rasa again will aggravate the Ruksha Guna. So we can go directly for throat sootheners. So no Tikshna Dravyas are not indicated here. Vada Shamana is the main protocol. A bit of Sidopaladi Churna with profuse amount of honey and bit of Krida. Because Rukshada is there, we have to compensate with the Rukshada with the Sniktha Dravya. So plain Krida will work nice. With excess amount of honey and a bit of Krida will do very nice, and give it as a throat soothana frequently. If the condition is a bit more worse, we can add Vadashamana Kridas. We can select Vadashamana Kridas for that. Vidaryadi Krida is the best option. Then comes Dhanvantara Krida. Even though it is told in Prameha Adhikarana, it's very nice, very effective for Vadika Kasa with the Kapanabandha. Sukumarakrita will be a better option if it's associated with constipation. Usually this Vada Rukshada is there in the throat. Usually that Rukshada will be found all around the body. So Krura Koshta is usually associated. Can use a bit of Arishta or cough syrup as Anupana to increase the Vyavahik guna. It's not that Arishta Kalpana is not usually indicated in pediatric practice. So you can use Arishta as Anupana. That is 3 or 5 drops of Arishta. You can mix this honey and grida along with that and can give. Cough syrup or lozenges is very useful. And be strict to regulate the quantity of cough syrup and lozenges if you are using. And you have to correct the mouth breathing because this hyperventilation is the triggering factor or is the main etiology of this Luksha Kasa. So correcting mouth breathing. Saline Kabbalah is very nice because Snikta Lavana is the Upashaya for this Shushka Kasa. And Kabbalam with Ulli Mopichita Velichana Vechitaka Kabbalam Malare Naldan. With Thaila processed Murchida Thaila in Palandu is very nice. Nasyam with Dhanodara Thaila will counteract the Dukshada in the upper respiratory tract. And soups are very nice, especially I advise usually now the kids are favorite have much affinity to non-veg. So I advise usually chicken soup, which is adinathu thanne korchu neyyum koodi varanathu karanam sakridamaayittu thanne kodukka. So it's very nice. Or vegetable soup also we can add a bit of pinch of ghee and give us include it in the diet. External abhyanga and Ushma Sweda is very nice in and around the neck region. If Kraura Koshtada is there, do manage it with a Matravasti or Snehavasti. And when a bit more Kaba is associated, you can go for other options like Kashaya options like Nayopayam, Ballajiraga, and Dashmula Kadatra and all that. Then if Kaba is a bit more associated and Abana Vaigunya is there, do a Deepana Pajana with Ashtachurna or you can go for Hinguvajadi also. Hello? Hello? Can
Hello,
I continue?
ma'am, clear and ma'am. Ma'am, continue.
Okay. Please note that if Vada Vilomata is there and Betha Vitkada is there associated with Vadiga Kasa, do an Abana Shuddhi or rule out that Abana Vaigunya. In such cases, you can go for Ashtachurna or Hinguvajadi or you can include it along with that other protocol. And always bear in mind that Sniktha Virejana should be opted for. And Thalisapatradi Lehyam will be a better option than the Thalisapatradi Vadagam, even though Kaba is associated. Because Thalisapatradi Lehya Haridagi is the main Haridagi is included instead of Shundi, which is the main which is included in Thalisapatradi Vadagam. This is a case. Now I'll after completing the Shushka Kasa, I'll go for a case study. I think you can see the picture of that baby. There is a boy aged 4 years with nasal congestion. Anunasika Vajanatva is a hyponasal speech. Foul smelling breath is there, halitosis. On further questioning, the mother said that he has a history of recurrent upper respiratory infection. Always, every month, once or twice, he will be having rhinitis and cough, along with appetite loss. He is having a usually snoring is there during the sleep. He is having dental caries and protruded teeth. You can see in the snap itself. He is well habituated with milk, biscuits, and even though he's 4 years, he consumes once or twice Amritam mix. That's Amritam mix is the weaning powder given by the Anganwadi. It's a bit Guru Guna and contains groundnut as well. Urunnum kappalandiയൊക്കെ ചേരുന്നതാണ്. കുറച്ചും കൂടി ഗുരു ഗുണത്വമുള്ളതാണ്. ഈ അമൃത മിക്സ് പാലി കുറുക്കി കഴിക്കണ ശീലമുണ്ട് ഈ കുട്ടിക്ക്. അതാണ് ആ presentation. ആ ഫോട്ടോയിൽ എന്തെങ്കിലും ഒരു ഡയഗ്നോസ് നമുക്ക് ആവാൻ പറ്റുമോ? Can you diagnose? Can anyone from the complaints and the snap? Anyone? You can unmute yourself and diagnose or type it in the chat box. He's having nasal congestion, hyponasal speech. He's having snoring during sleep. Then history of recurrent upper respiratory infection.
It's
Anyone?
adenoid hypertrophy, madam.
Sure. May I know is that?
This is Dr. Ramchandra Babar from Pune, madam.
Oh, from Pune. Thank you, sir. So it's adenoid hypertrophy. The facial features itself is diagnostic. It's hypertrophy nasopharyngeal tonsil. Usually this Valdez ring of tonsils developed by the age of 1 to 2 years and goes on enlarging by 5 to 6 years, then shrink and go subside itself after the age, also after the baby reaches puberty, resolves itself by puberty. So the maximum age group of this adenoid hypertrophy is 4 to 10 years. So perfect complaints are mouth breathing and snoring during sleep, halitosis, recurrent rhinorrhea will be there. The sleep will be disturbed. Why? Because the nasal obstruction will be there and sleep apnea. So disturbed sleep will be there. Recurrent otitis media. Why? Because this eustachian tube is opening near to that adenoid. So when the adenoid gland gets hypertrophied, it will block the eustachian tube and secretions from the middle ear cannot pass on to the pharynx. Thereby, the secretions from the middle ear have to get collected in that tract. So recurrent otitis media will be an associated feature. Adenoid phases will be there with open mouth and all, and a bit upward tilted face. മുഖം ഒന്ന് ഇത്തിരി പൊക്കി വെച്ചിരിക്കും. മൂക്കിൽ നിന്ന് എപ്പോഴും ഒലിക്കണോണ്ടായിരിക്കും അത്തിരി പൊക്കി വെച്ചൊരു ശീലമാണ്. This is the Valdez ring of tonsil. I think everyone familiar with, just brushing through. This pharyngeal tonsil, that is adenoid on the top. Then either side, palatine tonsils, and beneath that, lingual tonsil. Diagrammatic representation, and the other one is also I have included. So adenoid, we cannot visualize it directly. So either we have to go for an X-ray or diagnose it from the clinical features or confirm the nasopharyngoscopy. The nasopharyngoscopy is not a baby-friendly procedure. So I better diagnose it with the clinical features and then prefer for confirmation with an X-ray. So while managing the adenoid hypertrophy, adenoid has two phases. Either it can be hypertrophied or it can be inflamed. When it is a hypertrophy alone, Pittanibandha features won't be there. It's just a kabaja swelling blocking nostrils. When it is get inflamed, that acute phase of inflammation is usually associated with Kabanibandha Pitta features. So to be clear with, adenoid hypertrophy is usually kabaja kasa associated. It's a kabaja block. It's like a granthi blocking the tract. And when it gets inflamed, that this kabaja granthi gets a pitta anubandha and kaba dosha goes into kobhavastha. So bear in mind that every time when the kaba goes to the kobhavastha, it needs an ushna guna for that. So that pitta, ushna guna will be the triggering factor. So here, this is a perfect case of adenoid hypertrophy. Adenoiditis features is not there. Now the baby is not having recurrent respiratory infection. Now the baby came to us for such recurrent episodes in the past, and now the baby is having only the snoring complaint. So I'll better go for an X-ray and see that how much adenoid hypertrophy is there and how large it is, and the proportion of this adenoid hypertrophy which is blocking that nasopharynx. It should be bear in mind that the size of the adenoid is not the actual matters, the actual thing which matters. The proportion of the size of adenoid to the size of nasopharynx is the actual determinant. I'll show it in the X-ray. I think this an
Madam?
lateral. Pare.
Can DNS be one of the reason for this?
DNS, actually, DNS, it's deviated to only single side. The other side nose is actually patent.
Okay.
So when though snoring is there, it's actually not the snoring. It's just from the sound comes from the nose actually.
Okay, madam.
This much mouth breathing and this much protrusion of teeth won't be there in DNS.
Yes. Okay, madam.
In adenoid hypertrophy, both the nostrils will be blocked. The blocking is from the posterior aspect of the nasopharynx. So
Okay.
baby will be both the nostrils will be blocked, and baby will be finding very difficult to consume the air through the nasopharynx. And so the only choice for the baby is mouth breathing.
Mouth breathing. Okay.
So in the daytime, the baby will be mouth breathing, and during the night also it will be similar, but that obstruction and the whistling sound will cause that snoring.
Okay, madam. Okay.
That sound is actually different from DNS.
DNS. Okay.
I think this X-ray is it's visible. That's why a clinical features, I'm suspecting adenoid hypertrophy, and I'm confirming it with the help of an X-ray. So I went for a lateral view of the head. I think this is the adenoid. Actually, nasopharynx should have been gone like this, and this nasopharynx would have been a wide opening, allowing the air and free air entry of air through this trachea. But now this nasopharynx is being constricted by the adenoid. I think you can see that, you can appreciate that. In this radiograph, this palatine tonsil is also enlarged, even though you can see that enlargement here also down. So this baby is having adenoid hypertrophy as well as palatine hypertrophy of a palatine tonsil. Photograph X-ray of another baby. The right one is the plain X-ray, and I have demarcated the border of the adenoid in the left one. You can see how the nasopharynx has been constricted, and so the baby is forced to have the mouth breathing. Confirmation with an X-ray is mandatory while diagnosing in adenoid hypertrophy. Actually, X-ray is not that much confirmatory to say that. I usually do confirm with an X-ray, but this is another, this X-ray of a baby, and I have added the CT of that same baby. You can see the difference. While doing that X-ray, I was of an opinion that the nasopharynx is there, it's patent, patency is preserved, but when I did a CT, the sagittal slice, one of the sagittal slices gave this result, because CT is multiple X-rays. You can have the precise knowledge of this adenoid hypertrophy more in CT, but it's not nice to expose a child to CT very oftenly. So I better go for an X-ray. CT is the golden tool for diagnosis. And this one is this is to be you have to bear in mind while diagnosing the adenoid. And usually the modern pediatrician or ENT surgeons will be advising a adenoidectomy, that is complete removal of adenoid, and along with tonsillectomy for patients having recurrent adenoiditis. So usually they come to us seeking that whether they can avoid a surgery, whether we can have a complete cure of such disease and all. So decision upon whether to avoid whether to advise an adenoidectomy or not depends upon this rule. You can see this is, I have drawn a line A. That is a line connecting the sphenoid. This is sphenoid bone, the tip of the sphenoid bone to the maximum convexity of the adenoid gland. This is A. And the next line, that straight line N, is from the sphenoid to the hard palate. I have drawn another line. So a ratio is calculated like A by N ratio. That is maximum convexity of the adenoid divided by caliber of the nasopharynx. That ratio need to be calculated. Usually it is below 50. If the ratio is below 50 means nasopharynx is highly patent. Adenoid hypertrophy is very minimal. As it goes on like to mild, moderate, and as the ratio reaches 0.8 or above, adenoidectomy is suggested, because when it reaches 0.8 or above, when the baby lies down flat on sleeping, the chance of sleep apnea is very, very much. So sleep apnea causing hypoxia. So for fear of the toxic damage to brain and all, if the ratio is above 0.8, we do advise for surgery. Otherwise, in all other cases of adenoid hypertrophy, it's very well manageable with our medication. So this is the management protocol, which I do adopt, adenoid management. So oral cavity, adenoid gland in the oral cavity is getting inflamed, and then recurrent inflammation is causing this hypertrophy. So you have to maintain oral hygiene strictly. So baby is advised to have to brush the teeth after every food. Usually the babies will be habituated to have snacks then and there. So better to restrict the food timing to 3 or 4 or 5 times, and advise them to have a gargling with hot water, or have a drink or gulp of hot water after each food time, and brush their teeth strictly before sleep. Maintain oral hygiene. Then nasal instillation is very, very much advised, because adenoid is not reachable so it's just posterior to the nasopharynx. So nasya, or I don't call it as nasya because it's not classical nasya, pradimarsha nasya or nasal instillation is the only way of medication to reach that glandular hypertrophy. In my clinical experience, I have very nice effects, or Muruvanna is found to be very effective in causing the shrinkage of adenoid hypertrophy and turbinate hypertrophy. Also, I do keep a Varti dipped in Muruvanna on the nose, and it's very, very effective in turbinate hypertrophy as well. If you process the Muruvanna in a bit of Mrudu Paga, it's very nice for kids. Usually we get Paga, which is causing a bit of increasing the tikshnada of its, or irritating the nasopharyngeal mucosa. If you can process the Muruvanna in a Mrudu Paga, it's very, very wonderful drug in managing this adenoid hypertrophy. Other drug options available in the market are Shadbindu Taila, Varanadi Kshirakruda, and be careful that you shouldn't use this drug in adenoid inflammation. Adenoiditis, it should be avoided. This is perfectly used for adenoid hypertrophy. Krishnadi Guliga is used as talam in younger kids. Then you can go for Tikshna Dravyas like Ugulu Panchapalachurna or Vyakshadi Vadaga. Vyakshadi Vadaga is usually used for Asya Tharana. While Vyakshadi Vadaga Tundur Katta like wisdom teeth in Davada Vechekambare. So Nalla Kabachedanana. Kanchanara Gugulu research studies were found to be very effective in reducing that Chedana property of adenoids. Effective ആയിട്ടുള്ള വളരെ സ്പെസിഫിക് ഇൻഡിക്കേഷൻ ഉള്ള കുറച്ച് യോഗങ്ങൾ എടുത്ത് വെച്ചതാണ് ഭാർഗി കണ്ണാതി കഷായം. Even though it's not readily available in the market, It's highly effective in reducing adenoid hypertrophy as well as tonsillar hypertrophy. ആ കവചമായിട്ടുള്ള അവസ്ഥയിൽ അത് ഷ്രിങ്ക് ചെയ്ത് കൊണ്ടുവരാൻ വളരെ എഫക്റ്റീവ് ആണ്. ഭാർഗി കണ കാസഹരി ഹരിദ്ര വാശാമൃത നാഗര ധാന്യകാന അത്രേ ഉള്ളൂ ഡ്രഗ്. വളരെ ചെറിയ യോഗമാണ്, നമുക്ക് എഴുതി കൊടുത്ത് വാങ്ങിപ്പിക്കാനും മതി. എന്നുവെച്ചാൽ adenoid hypertrophy is a distressing disease, so the parents will be very conscious how to reduce the size of the tonsil. So it's a very short yoga and you can prescribe to have it from the raw medicine store and have it. Bhargi kana kasahari haridra vasha amrita nagara dhanyagana. Arogya Kalpadrumatala, this Rasna Upakulyadi Kashaya is specially narrated for Nasa Arshas in Arogya Kalpadruma. Nasa Arshas are indicated angle hypertrophy, turbinate hypertrophy reduction, adenoid and tonsillar hypertrophy reduction, വളരെ effective ആയിട്ട് കാണുന്നുണ്ട്. ക്ലിനിക്സിൽ വളരെ കോമൺ ആയിട്ട് കൊടുക്കുന്നതാണ് രാസ്ന ഉപകുല്യാദി കഷായം. രാസ്ന ഉപകുല്യ ദേവാഹ്വ താമലക്യ അഭയാഗ്നിഭി ചവ്യനാഗര സംയുക്തേക്വാദ നാസാർഷോഹിത. നാസാർഷസാംഹിത എന്നാണ്. സോ നാസാർഷസ് യൂഷ്വലി അങ്ങനെ കുട്ടികളിൽ കാണാറില്ല, ബിക്കോസ് നാസാർഷസ് ഇസ് നോട്ട് so popular in kids. I usually advise specifically for reducing that hypertrophy of tonsillar hypertrophy. Vyakriyadi Kasha, I think everyone is familiar with. It is Vata Kapahara and predominantly Kapha Anubandha Vadahara. So it's also it's easily available drug in the market. Pipali Churna Samhita. Pipali is a Prakshepa Churna in that. Only 3 drugs are the Vyakri, Shundya, Amurda. And regarding the single drugs in tonsillar adenoid hypertrophy, Ardraka Swarasa Vithani. Swarasam Sringivedasya Makshigena Samanyutam Payet Shwasa Kasakhanam Pradishyaya Kabahara. This typical wherever the typical kabacha kasa is seen, do give Ardraka Swarasa Vithani, because it's easily available in every home, and the palatability is also very nice. So usually kids love to have it. If you add a little bit of lemon juice in that, it's highly palatable. Use of Sahadevi, Puvankuranal and Shashasrudi, the Muyalchevi. മുയൽച്ചെവിയും പൂവാങ്കുറുന്നലും വളരെ എഫക്റ്റീവ് ആയിട്ട് കൊടുക്കുന്നതാണ്. മുയൽച്ചെവി അരച്ച് കൽക്കമായിട്ട്, the kalka of മുയൽച്ചെവി is shashasrudi is very widely applied in adenoid and tonsillar hypertrophy. And Parnayavani or പനിക്കൂർക്ക ഞാൻ പറയേണ്ട കാര്യമില്ല. പനിക്കൂർക്ക നീരിൽ തളം വെക്കാനും വാട്ടിപ്പിഴിഞ്ഞ നീരുള്ളിൽ കൊടുക്കാനും അതിട്ട് വെന്ത വെള്ളം. ചെറിയ കുട്ടികളൊക്കെ ആണെങ്കിൽ Fanda Kashaya with Parnayavani is very widely applied in the management of upper respiratory infection. And Parnayavani, Panikurka, Tanalil to Vati, the powder either Nerge, Tirimano, the Kutelka, Vangara, effective one, Tala Verkana Kutelka. Usually, kids having the sweating of head. Usually it won't be a complaint. If you go on examining every baby with recurrent upper respiratory infection, you will find that the baby will be having excessive sweating of scalp. Excessive sweating of scalp indicates an indicator for increased kleda pava in that, or abhishyanta in that baby. So Kaba Pitta Dushti is an index. So in that case and all, Kledahara Dravyas have to be incorporated, or Kledahara head application, oils, Kledahara drugs processed in oils can be used for head application daily to prevent an exacerbation. So adenoid management, other available drugs easily available in the market, Pathya Katvaladi Kashayam, Varanadi Kashayam is a very popular drug. Be a bit more cautious. Usually it's better to avoid in younger ages. Yoshadi Vadaga Sasya Dharana, it's a very nice decision. Rasna Dashmula Krida can be advised for when the Nirama Avastha is over, Rasna Dashmula Kridam and Agastya Rasayana is a better option. തലക്കെണ്ണയായിട്ട് for head application, നിർഗുണ്ഡ്യാധികേരം, നാഗരാധികേരം, വജാലക്ഷണാധികേരം ഒക്കെ നല്ലതാണ്. SNAക്ക് ദേവദാർവ്യാധികേരം എന്ന് പറഞ്ഞൊരു യോഗമുണ്ട്. എന്റെ ഡ്രഗ് ഓഫ് ചോയ്സ് എപ്പോഴും അതാണ്. Indication of tonsillectomy. Enlarged, that is A/N ratio above 0.8. Enlargement causing nasal airway obstruction, sleep apnea, or recurrent CSOM, chronic suppurative otitis media. പലവട്ടം വരിക, പലവട്ടം വന്നിട്ട് leading to conductive deafness. Then it's better go for adenoidectomy, because ആ ഏജിൽ conductive deafness വരുമ്പോൾ speech initiation ഒക്കെ ബുദ്ധിമുട്ടാവും. So better for an adenoidectomy. This is the second case, case 2. Girl aged 8 years, see the face, typical face. Girl aged 8 years with purulent nasal discharge and productive cough. എന്ന് പറയുമ്പോൾ ഞാൻ പറഞ്ഞു, I have told already, it is pitta kapacha kasa with yellowish thick sputum associated with nausea and vomiting, especially after food intake. So naturally the appetite is reduced. Fever since last night. History of such episodes frequently once or twice a month, demanding antibiotic therapy. So this time they came for Ayurvedic management. Mouth breathing and snoring noted for the last 1.5 years. History of recurrent suppurative otitis media. Head sweating is also there. On examination, tonsils were inflamed. So diagnose index towards tonsillitis. Postnasal drip was there. Disturbed sleep during acute episodes. So on X-ray, and I came to know that it's an adenoiditis with tonsillitis. Usually when tonsils get inflamed, the nearby the valves ring completely get inflamed. So adenoiditis with tonsillitis. Many bacterial and viral causes are there. So acute condition, it's Paithiga Kasa or Paithiga Avastha with the Kabanabandha. The Sthanika dosha is Kaba. When the Pitta gets associated, it gets to the Abhishyanda or increased Kleda is the. And the typical mouth faces you have to be thorough with, because the clinical that it's a case of spot diagnosis. That elongated face with open mouth breathing, with short upper lip and thin nostrils, and malpositioned and prominent upper teeth. You can see രണ്ട് ഫ്രണ്ടിലത്തെ ഇൻസിസേഴ്സ് വലിയത് മാതിരി ഇരിക്കും. നമ്മളെ സ്കൂളിലൊക്കെ പഠിക്കുമ്പോൾ കുറെ പേരുണ്ടായിരുന്നല്ലേ, പല്ലൊക്കെ ഉന്തിയിട്ട് എപ്പോഴും മൂക്കുന്നൊക്കെ ഒലിച്ചിട്ട്. Malpositioned and prominent upper teeth, hypoplastic upper jaw, and high arched palate. Typical adenoid face. ഇവർ ഉറങ്ങുന്ന കണ്ടോ? This is a sleeping pattern. മലന്ന് കിടന്ന് ഉറങ്ങാൻ പറ്റില്ല. It's difficult for them to lie supine. So they prefer this left lateral or right lateral position with the open mouth. And the saliva will be dribbling. That's a typical sleeping pattern. Or otherwise they be lying on the belly. See on the fourth picture, the baby is lying on the belly. So this is a case of Paithiga Kasa. So Paithiga Kasa can be associated with Tanu Kaba or Khana Kaba, depending upon the degree of Kaba vitiation associated. So usually associated with fever, bitter taste, Tikta Asida will be the bitter taste in mouth. Inflammatory signs are present, pharyngitis, tonsillitis, everything will be reddened and inflamed, yellow colored sputum. Sometimes it's maybe associated with GERD or Amla Pitta. So Paithiga Kasa management protocol is strictly adopted here. So here Sniktha and Ushna Guna is dominant. So I'll go for the opposite Guna, that is Ruksha Shita. Rukshashida drugs can be opted for. Sidopaladi Churna or Talisadi Churna in Vashaswarasam can be opted for. Fever is always associated. So do manage the fever, because fever may go unmanaged as the baby is very young. So head application or talam we call in Kerala, typical Kerala practice. വെള്ളക്ക തളം വെക്കാൻ പറയാറുണ്ട്. വെള്ളക്ക is the tender small one coconut which is available, which is very easy to rub with plain water. വെള്ളക്ക തളം വെക്കാൻ പറയാറുണ്ട്. ശീതമാണ്, രൂക്ഷമാണ്, ജ്വരഹരമാണ്. Again, Parnayavani with Kachuradi Churna, another option. If Abhishyanda is more, Shigraswarasa along with Krishnadi Guliga will give wonderful results, very effective in managing the Abhishyanda. Patya Gustambariyadi Kashaya is a drug of choice. It is mentioned in Jwara Adhikarana, and it's Patya Kustambari Musta, Shundi Kartana Parpadam, Sa Katfala Vajapharni, Devahum, Madhu Hinguvat, Vada Kaba Jwara Shtiva, Kukshi Hitparshavetana, Kanda Amaya Astyashvayedu, Kasa Shwasan Vinichadi. That's a typical indication. Kanda Amaya Astyashvayedu, Kasa Shwasan Vinichadi. That's a sure shot drug in the acute phase of tonsillitis and adenoiditis. Another drug option is Balajiragadi. It's easily available in the market. This another effective combination from Arogya Kalpadruma, Evakshara Churna. It can be used for Asya Pratisarana or internal administration as well. Only 5 drugs are there: Evakshara, Pippali, Jiraga, Krishna Jiraga, Mayak. And you can powder it. Mix it with Krishna Tulasi Swarasa and honey. It's very effective drug in managing this Pitta Kapakasa or associated with Tundikerika. Fever management also should be done simultaneously for fear of aggravating that temperature. Then again, steam inhalation through the nose is another option. Nasal instillation of to evacuate or to clear up that stagnated sputum on the adenoids and tonsillitis, tonsils. We have to better go for nasal instillation of saline drops. Kabalam can be advised in bit more or elder children who are habituated to that. Varakwada, that's Tribala plus ST. Tribala, it's very effective in Kledahara and Shoshana, Shobahara and all. But palatability of Tribala is not well accepted by the kids. And Tribala is Levana Varjida. So I add a bit of Levana in that. Then the palatability will improve very nicely. So when you add a bit of Levana in Tribala Kashaya, then the sweet taste is much more dominant. So it becomes more palatable, and it's not contraindicated in this stage. So Vara Kashaya with a bit of salt. Just add a bit of salt to increase the palatability, not much. And it's used for Kabala. Panchatikta Kashaya is used for Kabala as well. A simple ST Churna, ST Kwada, because of the palatability, it is very sweet, can be used for Kabala. I usually go for a throat paint for reducing the acute condition of this tonsillitis. Usually tonsillar inflammation will be so fulminant that the condition will be causing a dysphagia and vomiting. So it's better to manage that acute condition with a throat paint so that you can the infection will be controlled within a few minutes or maximum half an hour. It's very tough to manage this disease with internal medicine and wait for a cure. So throat paint with Kadiradi Gulika. I make a paste of Kadiradi Gulika with ginger juice, a bit of lemon juice and salt. Apply it. My intention is to apply it on the tonsil, but it's a bit tough in the early stages. So I apply it on the gum of the premolar teeth, then slowly proceed to the molars, and then to the fosses, and then to the tonsil. So when you reach the tonsil, if you can apply this paste on the tonsil will be emitting the pus like anything, and the acute stage can be managed within an hour. Khadira, if the baby is not cooperative with that, Khadira Gulga can be given for Asya Dharana as well. Akshatok or Tamnika violet chavakino valare nallatana. Then external labana around the tender cervical glands with kartavat or kuruvilla kadika. Kochukutel kakani kuruvilla kadika arachitalam madhyao is also very nice. acute adenoiditis tonsillitis management is very well done with Balachadurpadra Rasa. Balachadurpadra Rasa എന്ന് പറയുന്നത് രസമൊന്നുമില്ല actually അതിനകത്ത്. Only 4 drugs are there: Adivisha, Musta, Sringi and Pipali. It's a very wonderful combination in managing the pediatric, acute pediatric Shwasa, Kasa, Jwara and Adisara. Readily available ആയിട്ട് കിട്ടുന്നില്ലെങ്കിൽ പൗഡർ ചെയ്ത് വെച്ചാലും മതിയായിരിക്കും. ചെറിയ ഡോസേ ഉള്ളൂ. വെട്ടുമാറിന്റെ ഗുളികയുടെ അത്രയും ചെറിയ ഡോസ് മതിയാവും. സോ വളരെ അതിവേട ഉള്ളത് കാരണം വളരെ എഫക്റ്റീവും ആണ്. പെട്ട അക്യൂട്ട് സ്റ്റേജ് മാനേജ് ചെയ്യാൻ വളരെ നന്നായിരിക്കും. സുദർശന വില്വാദി വെട്ടുമാറൻ ഗുളികകളൊക്കെ ആസ് യൂഷ്വൽ പ്രാക്ടീസിലുള്ള പോലെ ആഡ് ഓൺ ചെയ്യാം. ഇത് സപ്തചതാദി കഷായം which is available in the market, very nice for internal use as well as for Kabala. സപ്തചത ഉശീര പടോല മുസ്ത ഹരിതഗി വളരെ മുഖാമയത്തിൽ ഇൻഡിക്കേറ്റ് ചെയ്തിരിക്കുന്നതാണ്. അഷ്ടാംഗഹൃദയത്തില് tonsillar acute phase of tonsillitis, it's very effective in for Kabbalah. I put this slides from a modern PowerPoint presentation just to indicate how they are advising. See, if a baby presenting with recurrent cough and recurrent upper respiratory infection, see the protocol of management. It's I will mention once more. It's from a modern PowerPoint presentation from a modern pediatrician. See how they are avoiding the recurrence: vitamin C, zinc, regular hand washing, immune boosters. Turmeric, honey, amla are the immune boosters, and they don't have anything to add from their system of medicine. And the next recommendation is alternative medicines for preventing the recurrence. So even the modern system of medicine is also recognizing our role in immunomodulation and our role in reducing the recurrence of upper respiratory infection. Then it's better to avoid this recommendation by WHO. It's not wise to advise antibiotic for each and every adenoiditis and tonsillitis episode. So if the cough is lasting more than 14 days, this purulent cough, if a bacterial form of pneumonia or whooping cough is diagnosed, then only go for an antibiotic. If sinus infection is there more than 10 days, then only go for that. Don't go for an antibiotic in the first or second day, even in the first week. Just wait for 10 days. Then a fever with more than 102 degrees Fahrenheit with yellow-green nasal discharge for several days in a row, then only go for antibiotic. And if the baby is having streptococcal throat infection, better to go for antibiotic for fear of rheumatic fever. So coming to lower respiratory infection, we are completed with adenoid hypertrophy, adopting the Kaba-Kasa Chilsa protocol. We are dealt with adenoiditis and tonsillitis, adopting the Paithya-Kasa with Kaba protocol. Next, we are coming to lower respiratory infection. The infection is a bit more worse that it had an access to the lower respiratory tract. Usually it will start an upper respiratory and proceed to a lower respiratory infection. So the same protocol of tonsillitis can be adopted, the same drugs, that is Pitta-Kasa with Kana-Kaba here. So same protocol can be adopted. And while going for, if the baby is diagnosed to have a lower respiratory tract infection, just go for an X-ray PA view. See for the gone focus. Gone focus is seen on the upper lobe. For fear of tonsillitis or primary complex, rule out that. Rule out with the help of Mantox test or AFB, acid-fast bacilli in the sputum. Then, if everything is intact, go for Pitta Kabashamana protocol, which I mentioned earlier, and Jwarahara should be given more importance here. Watch out for the pneumonic signs. If the baby is having a pneumonic sign, that is more respiratory rate more than 40 and fever more than 102 with an air hunger better try to manage it in 1 day and then go for, if it's not getting control, better to refer the baby. I usually manage such lower respiratory infections with the help of ARCA. This is the yoga of combination of ARCA, which I use in my clinical practice. Parnayavani, Tampula, Tulasi, Ardraga, Vasha, and Adakya. അരക്കൊക്കെ അറ്റച്ചു ഇത്ര കൂടി ആയിട്ടാണ് അർക്കം എടുക്കുക. അർക്കം എടുത്തിട്ട് തേനും ചേർത്ത് കൊടുക്കുക ചെയ്യുന്നത്. പർണേവാനി, താമ്പൂലം, തുളസി, വാഷ. എനിക്ക് യൂഷ്വലി I have an arc of separate individual drugs with me. So depending upon the condition, I can add each of the arca and have a combination. This one is a special indication for managing the lower respiratory infection, bronchitis and pneumonia. It's Jatyadi Ilanir Lepa. It's narrated in Arogya Kalpadruma, in Kabaja Jwara. Very effective in helping the baby to expectorate out the sputum. Usually the productive cough will be associated, and so worsening productive cough will be there, and the baby will finding it tough to cough out that sputum. So this is a wonderful yoga. You can make a paste out of that, have an external application on the chest and the mid-scapular region. When it just rise off, do the chest physiotherapy in the down belly posture. The cough will be coming out very nicely, very easily. So to expectorate out the entrapped sputum, this yoga is very nice. It has shelf life more than 3 months. Like you can powder it and keep it in a shelf. Just mix it with tender coconut water, boil it out, make a paste, and then apply on the chest and mid-scapular region. And do chest physiotherapy after that. I include this in my regular practice whenever there is a lower respiratory infection. Again, Bala Chadurpadra Rasa can be included. Do go for chest physiotherapy every time when the baby is having a lower respiratory infection. Chest physiotherapy can be done by an expert hand, or you can train the parent to do such procedures daily. And you should incorporate resa drugs like Siddhamarthaja and Pravala Basma, Shwasananda, etc. while managing LRTI for fear of proceeding it for pneumonia. And when a case of a lower respiratory infection come to you, bear in mind that it won't be a perfect lung pathology. Usually a child under 8 years presenting to you with a LRTI, the chances of congenital heart disease complicating case will be very much more. So whenever a baby is presenting you with LRTI, with repeated LRTI, do have an echo or do have at least an X-ray and see that any right atrial hypertrophy or right ventricular hypertrophy is there. Because congenital heart disease is very common in younger ages. You may be knowing that foramen ovale was there connecting that right and left atrium, and it was supposed to get closed in the first breath. When it's not closed, not getting closed, there is a connection opening connecting both the left and right atrium, and after birth we won't be calling it as foramen ovale. We are supposed to call it as atrial septal defect. So atrial septal defect is very common in kids under 8 years. So whoever is having this atrial septal defect, the blood will be pumping out from the left heart to the right heart. So the right heart will be overloaded with excess amount of blood, pushing it to the pulmonary circulation. So pulmonary circulation will be overloaded, leading to pulmonary hypertension and leading to wet lungs. This pulmonary hypertension will force the increased amount of plasma to leak into this lung tissue. So the lung tissue will be having an increased amount of leaking plasma in that, creating it a culture medium or an invitation for each and every microorganism to come over there and multiply. So babies having a congenital heart disease, that is will be more prone to have recurrent lower respiratory infection. So any baby coming in front of you with more than one episode of LRTI should be evaluated for congenital heart disease. This is a research study, and even in clinical practice, if you are very proficient in auscultating the heart sounds, simple auscultation can reveal that ASD defect. But if you are not thorough in auscultating the heart sounds, better go for an echo, or just an X-ray can reveal that. Then recurrent LRTI or recurrent bronchitis, Pitta-Gasa with Kabanubanda, Kushmanda for recurrent, for avoiding the recurrence, Rasayana drugs having Rasayana property can be included or should be included. Kushmanda Rasayana is a very good option in the recurrent LRTI. Elajamodadi Rasayana is very nice. Brishakrida is very effective in managing LRTI associated with congenital heart disease. Again, Amritaprasha is nice. Rasna Dashamulakrida is advised when the Kaba dominance is more than the Pitta. If it's a congenital heart disease, the Kashaya option is Balajiragadi Kashaya is the better option. Exertional dyspnea, Nayopaya Kashaya is my better option. Then dry cough or tenacious cough or tenacious sputum which is tough to expectorate, Dashmula Kadatra is very nice because Dashmula Kadatra, this Kabachedahara property of Trigadu is there along with it Vatashamana properties, and that dilatation is better done with that Vasha over that. Then dyspnea is usually associated with Pandu. Then Panal Veradi is a traditional yoga which we advise in kids. Then I think we have divided up the sector. Then coming to bronchial asthma. It's a usual presentation or bread and butter of a pediatrician. So bronchial asthma is usually of two types, Tamaka and Pratamaka. Tamaka Shwasa is usually Vada Kapacha type. Then the other type is where the Paitika involvement is there. We call it as Pratamaka. Shide Shamye Pratamagastuta. That is Pratamaka Shwasa. It will come down with Shida Guna. So I'll broadly divide this VC chest into two, Tamaka and Pratamaka. Tamaka is Vada Kapa dominant and Pratamaka Shwasa is Vada Paitika dominant. Go for absolute eosinophil, IgE, X-ray PA, then pulmonary function test, pyrometric evaluation. Do have a thorough investigation before managing. External Snehasveda will be very effective in acute stages. Do avoid steam inhalation because Kaba will be going to Vilayana Avastha. Dry heat will be very effective in managing because in steam inhalation, we will be compensating the existing supply of oxygen with that highly humid air. So the baby will be feeling very much air hunger during that steam inhalation. So better to avoid that steam inhalation and go for a dry heat. ചെറിയ ചൂട് വെച്ചാൽ മതിയായിരിക്കും. അയൺ ബോക്സ് വെച്ചിട്ട് ചെറിയ പോട്ടലി സ്വേദോ പടസ്വേദം എന്നൊക്കെ നമ്മൾ പറയുന്ന പോലെ ചൂടാക്കി ചെയ്താൽ മതിയായിരിക്കും. മണല് വറുത്ത് കിഴി വെക്കുന്നതൊക്കെ വളരെ എഫക്റ്റീവാണ്. ഇൻ മർമ്മ തെറാപ്പി ഒരു വിളങ്ക മർമ്മം പറയുന്നുണ്ട് ദിസ് സൈഡിൽ. അത് സ്റ്റിമുലേറ്റ് ചെയ്യുന്നതും അക്യൂട്ട് സ്റ്റേജസ് മാനേജ് ചെയ്യാൻ വളരെ നല്ലതാണ്. കുട്ടികളിൽ അത് വളരെ എഫക്റ്റീവായിട്ട് ഞാൻ കണ്ടിട്ടുണ്ട്. PO2 വളരെ പെട്ടെന്ന് തന്നെ കൂടുന്നുണ്ട്. So bronchodilation is mandatory. We have to go for drugs having bronchodilatic capacity. Kanagasa is a wonderful drug. ആസവായിട്ട് തേനിലാണ് കിട്ടുന്നത്. Kanaga is a evident bronchodilatory drug. It's very promising results. Kanagasava. combined with Balajirakadi Kashayam. Usually Arishta Matra at a Kutelka Kodakanam Nala Enikilla for fear of Tikshnada hampering the gastric mucosa. So in clinical practice, I usually add Arishta Kalpana along with Kashaya and a bit of cup syrup in that, so that the palatability of that combination is a bit more triggered. So bronchodilatory capacity or drugs use ചെയ്യാം. Then വെറ്റില ചേർത്തിട്ടുള്ള യോഗങ്ങൾ വളരെ നല്ലതാണ് for that much powerful bronchodilation. വെറ്റില അർക്കം is very nice. അർക്കം വളരെ effective ആയിട്ട് യൂസ് ചെയ്യാം pediatric practice. That palatability നല്ലതാണ്, sudden drug action, easily absorption. തമകശ്വാസത്തില് ജിഞ്ചർ ആർദ്രകസ്വരസ ഇത്തിരി ഉപ്പും കൂടി ചേർത്ത് കൊടുക്കുന്നത് ആ ഒരു കഫവിലയനം വരാൻ ഒത്തിരി നല്ലതാണ്. In bronchial asthma, restrict excessive food intake, excessive carb എടുക്കുന്നത് കട്ട് ചെയ്യണം. Heavy proteins, especially milk protein, should be completely cut down and patch up with other proteins like fish and jangala mamsa is very nice. Strictly cut down all the maida based white flour based food items like biscuits and all. Usually smoke, agarbatti, fry, the smell of the something frying in coconut oil and will be triggering that asthmatic episode. So avoid or have a good exhaust in the kitchen. The dust emitted by the cockroach is a very powerful bronchial asthma, the allergic trigger usually in kids. So the dust the house should be cockroach free. Clean the premises with moist cloth. Respiratory exercises are mandatory in the avegavastha of bronchial asthma. So kids won't like to have pranayama exercises as in the pure form. So respiratory exercises or abdominal exercises will do the function of increasing that vital capacity of the lung. Controlled physical exercises will be nice. Controlled physical exercises will be nice. Tegaraja Erenda Thailam on head application is വളരെ effective ആയിട്ടുള്ള ഒരു simple remedy ആണ്, especially in infants. Vyakriyadi Kashayam, Vyoshadi Vadagam, Dashmulakatrayam Kashayam, especially advised in Vadakapaja Tamakashwasatila. Nothing to add more. Bronchodilation with Arka and Arishta Kalpana. Then Dhanvantara, the Shwasananda Gudiga can be added along with that to calm down that aggravated Vada Dushti. Then we had conducted a research study in our department in mild to moderate persistent bronchial asthma. We had enrolled 400 children in that with mild to moderate bronchial asthma who are not on steroid inhalers. So we divided into two groups. The one control group was put on yoga therapy alone. Then the other group was put on Vyakri Haridaki Lehyam and Vidanga Rajanyadi Churna along with yoga therapy. So control group was on yoga therapy and the treated group was on yoga therapy along with the trial drug. The trial, only 2 drugs were used. Vyakri Haridaki Lehya is mentioned in Baishiratnavali. It is a very palatable formulation. Vyakri is the main kashaya and very few Praksheba drugs are. Vyakri and Haridagi are only 2 main drugs. Now only Praksheba drugs are there in other forms. And Vidanga Rajanyadi Churna is a yoga in the Arogyakalpatruma in the Krimi Roga Adhikarana, because allergic manifestations are the triggering points in asthma episodes. So Krimikhna, this Kledahara drug is Vidanga Rajanyadi was incorporated. Both were palatable formulations and were widely accepted by the kids. Given twice a day. And spirometric evaluation before and after that trial period was used as a main assessment criteria along with that morbidity measures. And it came out that which was very highly effective in controlling that, preventing the recurrence and controlling the acute episodes of mild to moderate bronchial asthma. And so we could statistically prove the efficacy of these drugs in managing the acute bronchial asthma in kids. So this all dealt with 4 main conditions: typical kapakasa, then Pythagasa with Kabanubandha, that is adenoids, tonsillitis, LRTI in that. Then the third one, Vata Kabaja type, Tamagasa. So I tried to divide all these respiratory infections into 3 broad categories and include that treatment. So I can emphasize that any doubts and suggestion, it's mostly welcome. Thank you. Thank you, one and all.
Thank you so much, ma'am. Next, we are moving to the next section, Q&A section. I would like to say that if you have any doubts regarding the presentation, kindly ask them right now, or you can mention them in the chat box.
Madam. Madam. Madam, during the Tamagashwasa condition, when we're using the Vasa preparations, since Vasa is having a kapha utklashana property, sometimes there's a presentation that the child will be presented with more difficulty. So how can we manage the kapha utklashana condition during that time, ma'am?
Vasa is actually an expectorant drug.
Yeah, ma'am.
So
yeah.
When the baby is finding difficult to expectorate, that's why I told you should incorporate chest physiotherapy along with that. Otherwise, that sputum will be getting entangled and baby will be finding difficult to cuff it. So that Kleda Bhava will be there and the Abhishyanda Bhava will be, we feel that the clinical presentation is getting worsened.
Worsened, yeah.
So do give a dry heat and do the chest physiotherapy. Chest physiotherapy should be included. Chest physiotherapy should be included in pediatric practice because their diaphragm is not so powerful to cuff every sputum out.
Yeah, madam. Yeah.
So if you are giving drugs like Vasha, we feel that clinical presentation is worsening. But actually, if you are otherwise, a suction apparatus will also help you a lot. But it's not easy to give a suction every time at home also. So just we can teach them to do the chest physiotherapy. Just make them lie on the belly. I think you may be familiar with the chest physiotherapy steps.
Yeah,
should I narrate it?
Yeah, please, Manu. Yeah, it will be helpful for everyone.
The baby should. Thank you. Then baby is made to lie on the belly. You have to place 2 or 3 pillows on the bed, and the baby is made to lie on her belly above this pillow, so that it's like a V-shaped posture. The belly is pressing that pillow, and head will be kept down, and the legs will be on the other side.
Okay.
So the chest will be will be favoring the gravity force. Chest will be coming down, and the head will be on the bed. മനസ്സിലായോ? ഇങ്ങനെ തലേണ വെച്ചിട്ട് അതിന്റെ മേലെ വയറമക്കി വെച്ചിട്ട് ഇങ്ങനെ കിടക്കണം. Head will be lying down and the belly will be pressing the pillow. Then you have to tap lung the lower lobe തൊട്ട് vacuum create ചെയ്ത് tap ചെയ്യണം. You have to cup your fingers like this and create a vacuum on the chest wall and tap it like this. You have to tap from the lower lobe of the lung and proceed slightly to the upper lobe. മേലെ നാണെങ്കിൽ ഇങ്ങനെ ടാപ്പ് ചെയ്ത് വരണം. അപ്പൊ ഫ്ലാറ്റ് ചെസ്റ്റ് ആയതാണ് ടാപ്പ് ചെയ്യുമ്പോൾ ഒരു വാക്യൂം സ്പേസ് ക്രിയേറ്റ് ചെയ്യും. So that it will be favoring the drainage of that sputum.
Okay, madam. Yeah.
Chest physiotherapy and that I told an external application with Jatyadi Ilanir Lepam.
Yeah, madam. Yeah.
It will be giving a very nice bronchodilatory effect. And if you do an external application with that powder and then do a chest physiotherapy, it will be very effective.
Okay.
Even if you don't do a chest physiotherapy, then also it's okay. With that labum, that bronchodilation will be there and cough. It will be easy to expectorate out.
Okay, madam. Okay. Thank you, madam.
Ma'am, there is a question in the chat box. Can I read it?
Okay, I will see it.
Can you explain ARCA preparation in detail?
So in ARCA preparation in detail. ARCA in some certain pharmacies are having ready-made ARCAs or certain drugs alone. I do prepare ARCA at home. I selected the Devya which need to be prepared into ARCA, make a kalka out of that, keep it in the pressure cooker available in the kitchen, then close it with that lid, remove that weight over that, and attach a heat resistant tube to that. Heat resistant tube is usually available in usually water heaters. Water heaters will be having an outlet with a heat resistant plastic tube, but it will be flexible. Have a 2 meters of heat resistant water tube, and it will be having a metal tubing inside. Attach the tubing onto the top of that pressure cooker. So, put a mild flame beneath so that the kalka will be getting cooked and the fumes will be getting collected in the pressure cooker, slowly transferring that aromatic fumes into that heat resistant tube. It's a long tube. We have a 2 meter of the heat resistant tube with us. So these fumes will be passing through the tube, and dip that middle portion of the tube in a bucket of water, so that these fumes traveling through this tube get condensed in that lukewarm water and then collect ARCA from the other tip of the tube. That's how I prepare ARCA. I can show a diagrammatic representation. Just a distillation apparatus at home, nothing more than that. Can you see this? I kept a bottle, kept a pressure cooker on top of the fire. I kept the medicines inside, covered it with the lid, and removed that weight over there. Attached a heat resistant pipe to it, and the pipe is so long, like 2 meters. So I can dip the meat portion in the water container, a bucket having water in it. So that these fumes coming through this tube will be getting condensed here, and you can collect the ARCA in the other outlet. Keep the ARCA, keep it in an amber colored bottle so that it will be having more shelf life. I usually prepare the ARCA with Vasha, then Karpura Yavani, then Tulsi, Hadra. It's very nice, very effective. We need only a little quantity of the drug, It's highly palatable and immediate effect it will be giving. So it's very, not only for this respiratory, for pediatric practice, it's very, it's mandatory to have an ARCA preparations with you. Then what else? Also in Sweda, instead of pada or cloth, Parnayavani leaf were also found effective to me. Sure. Vivid applications of Parnayavani in upper respiratory infections is the Kerala special protocol, I think. പനിക്കുട്ടനീല വാട്ടി പിഴിഞ്ഞിട്ട് നെഗയിൽ വെക്കുക, then അത് അരച്ച് ഉരുട്ടി ഉള്ളിൽ കൊടുക്കുക, അതിട്ട് വെള്ളം തിളപ്പിച്ച് കൊടുക്കുക, അത് തളം വെക്കാൻ എടുക്കുക, അതിന്റെ വാട്ടിപ്പിഴിഞ്ഞ നീര് കൊടുക്കുക, അതൊക്കെ വളരെ നല്ലതാ. ചെറിയ കുട്ടികൾക്കൊക്കെ അത് ചൂടാക്കിയിട്ട് വെക്കുന്നതും ഒക്കെ ഭയങ്കര എഫക്റ്റീവാണ്. In allergic cough, got result with Haridra Marijadi Lehyam and Crimicna Vadina associated with sinus. Yeah, that's a very nice suggestion. Allergic cough. Whenever there is an allergic manifestation, you have to bear in mind that chance of infestation is very much. Helminthes will be causing an allergic spectrum much more in younger kids. So if you are facing an allergic rhinitis or allergic cough or something like that, do go for a deworming, or Crimicna chilsa should be incorporated with that. Thank you. How much time this ARCA can be kept? If you're keeping the ARCA in amber colored bottle, usually the shelf life is, in a textual reference, is shelf life is 6 months. I do keep only for 3 months. Anything more? Anything more in the chat box? Remya raised hand. Hello, Dr. Remya.
Hi, ma'am. Thanks a lot for the wonderful class. I just wanted to ask you regarding COVID management in kids.
COVID management. Wonderful question. Actually, COVID symptomatology and respiratory symptomatology is very milder in kids under 12 years, because their lung tissue is habituated for the lung manifestation is very minimal. GIT manifestations are more seen in COVID population. Why? Because we are vaccinated with against tuberculosis. These developing countries are vaccinated. Almost all the kids are vaccinated for BCG vaccination for tuberculosis. This tuberculosis vaccination is having a protective function against many of the viral and bacterial infections. So the lung manifestations are very minimal in kids for this COVID, but GIT manifestations are much more. So kids are having an infestation with COVID is having diarrhea, vomiting, and GIT manifestations are much more. Lung manifestation is minimal with just cough, a bit of dyspnea, and that much. Severe and more, even though more morbidity status is much more. The chance of kids to get COVID infection is very, very much because of this immunocompromised stage in pediatric age group. But even though they turn serum positive for the COVID test, their clinical manifestation is less, and mortality rate, that is death rate, is very, very, very less when compared to adult population. So it's not a frightening situation when you face a child with COVID, but children with respiratory complaints like COPD or cystic fibrosis or severe cases of bronchial asthma, when they get a COVID infestation, it's not nice. Otherwise, COVID is not a fearful disease in normal pediatric population. GIT manifestations has to be dealt symptomatic management of such like you treat it like a classical Adisara or Chardi, nothing more than that. It will be soon under control. It's not a alarming or fulminating stage. But if a baby having or a bedridden baby or a baby having a long history of bronchial asthma, severe bronchial asthma on steroid medications, or a baby with cystic fibrosis is exposed to a COVID infestation, it won't be giving a good results. Am I clear, doctor?
Thank you so much, ma'am.
Okay.
Madam. Madam. Suppose if a child is presenting with the COVID positive symptoms, can we use the same treatment protocol just as we follow in the adult, or shall we need to reduce the dose, or like we are using Sudarshana tablet and all, Vilwadi and all? So can the Sudarshana can be given as BD, or we need to cut short the dosage as one per day, one tablet per day?
Yeah, half Sudarshana twice daily is enough in pediatric population. Or Vilwadi, there are no contraindication in advising Sudarshana or Vilwadi in child population. Just reduce the dose of the drug. That much is okay.
Okay, madam. Okay, fine.
Usually, clinical manifestation is very, very less in pediatric population. So, you can easily manage. Nothing to fear about that.
Okay. Most of the time when
usually
we are
they work as the carriers of the disease.
Yeah, most of the time when we are posted in CFLTC, we need to treat child also, like 3-year-old or even 6 months child also, because their parents will be having the COVID, and from the parents, the child will be also infested. So during that time, most of the time, so now we can give the Ayurveda treatment also. So we are giving the Sudarshan tablets along with the other antibiotic and all.
No issue. Actually, there is no need of antibiotic therapy in kids. Actually, the antibiotic therapy is worsening the GIT manifestation. No need of antibiotic therapy. Our medicines is highly effective in managing COVID manifestation in children. Okay. Adults also have seen the wonderful results, but in pediatric population, nothing to worry about that.
Okay, madam.
Because a worsening condition is never seen. Morbidity and mortality rates are very, very, very low.
Okay.
Easily manage.
Okay, madam. Thank you.
Ma'am, any particular Anupana for that?
Which one?
As you said, Sudarshana tab and Vilwadi can be given. So any particular Anupana for that?
Usually kids having a underlying kapha dominant stage, we go for drugs like Barnyadi or Dashmula Katraya in these stages. So we couple Gulika along with that. It's not actually as Anupana. We do give a Kashaya Kalpana and add on with the Gulika along with that. The Sudarshana Churna can be, usually they won't gulp the tablet as such. So it can be powder with honey, made into a paste with honey and be given twice a day. Vilwadi is much more better option in kids because of that underlying indigestion, kabhavrti, and all. Better than the Sudarshana, Vilwadi is a much more better option.
Thank you so much, ma'am.
Thank you, ma'am, for the Q&A session. The knowledge regarding the topic is impeccable. Thank you for sharing it with us.
Thank you. Thank you for the patient hearing. I think I took more than 1 hour for the presentation because it was a very tough job to include all these diseases under 3 or 4 headings. So I tried my level best. Hope you could get something out of that. Thank you. Thank you for the organizers, Dr. Baiju, Dr. Ashwati, and Dr. Vinu, everyone for this well-organized webinar series.
ടീച്ചറെ ഞങ്ങളെ നന്ദി പറച്ചില് തീർന്നില്ല.
ആണോ?
രമ ഡോക്ടർ ഉണ്ട് നമ്മുടെ ആറ്റിങ്ങൽ ചെയർപേഴ്സൺ. ഡോക്ടറെ
ഹലോ ഹലോ ഡോക്ടറെ, വളരെ നല്ല ക്ലാസ് ആയിരുന്നു. ഏറ്റവും വളരെ ഇൻഫർമേറ്റീവ് ആയിട്ടുള്ള ക്ലാസ് ആയിരുന്നു. അത് എല്ലാവർക്കും വളരെ ഉപകാരപ്രദവും അതുപോലെ നല്ല ടിപ്സ് ഒക്കെ കിട്ടിയായിരുന്നു ഈ ക്ലാസ്സിൽ നിന്ന്. ഇതിന് മുന്നേ ക്ലാസ്സിൽ വേറൊരു ക്ലാസ്സിൽ കേട്ടിട്ടുണ്ടായിരുന്നു, 2-3 ക്ലാസ് ഡോക്ടറുടെ കേട്ടിട്ടുണ്ടായിരുന്നു. വളരെ നല്ല ക്ലാസ് ആണ്, വളരെ ഇൻട്രസ്റ്റിംഗ് ആണ്, എല്ലാവർക്കും നല്ല മനസ്സിലാവുന്ന ഭാഷയിലും അതുപോലെ തന്നെ നല്ല രീതിക്ക് പറഞ്ഞ ഡോക്ടർക്ക് ഞങ്ങളുടെ AMIയുടെ ആറ്റിങ്ങൽ ഏരിയയുടെയും വർക്കല ആശുപത്രിയുടെയും പേരില് ഞാൻ നന്ദി പറഞ്ഞുകൊള്ളുന്നു.
സന്തോഷം ഡോക്ടറെ.
വളരെ നല്ല ക്ലാസ് ആയിരുന്നു ഡോക്ടർ. ഞങ്ങളുടെ എല്ലാ നന്ദിയും അറിയിക്കുകയാണ് ഇതിൽ പങ്കെടുത്ത എല്ലാ ഡോക്ടേഴ്സിനും. വളരെ ഞങ്ങളുടെ ഈ ആറ്റിങ്ങൽ ഏരിയയുടെയും വർക്കല ആശുപത്രിയുടെയും പേരിൽ നന്ദി രേഖപ്പെടുത്തിക്കൊള്ളുന്നു. ഓക്കെ. ഹലോ.
അശ്വതി കഴിഞ്ഞോ?
ഞാൻ ടീച്ചറെ സൂപ്പർ ആയിരുന്നു കേട്ടോ. വളരെ ഭയങ്കര ഇതായിട്ടുള്ളൊരു ക്ലാസ് ആയിരുന്നേ. ഭയങ്കര ഇൻഫോർമേറ്റീവ് ആയിരുന്നു.
ചുരുക്കിയപ്പോ കുഴപ്പമായില്ലല്ലോ അല്ലേ?
ഇല്ല ടീച്ചറെ, അയ്യോ അത് തന്നെ ഒത്തിരി ഉണ്ടായിരുന്നല്ലോ. നമുക്ക് ഒത്തിരി പ്രാക്ടിക്കലി യൂസ്ഫുൾ ആയിട്ടുള്ള ക്ലാസ് ആയിരുന്നു. ഒരുപാട് നന്ദിയുണ്ട് ടീച്ചറെ. ഞങ്ങളുടെ വെബിനാറിന്റെ ലാസ്റ്റ് സീരീസ് ഭയങ്കര എന്താ പറയാ, നന്നായിട്ട് പാർട്ടിസിപ്പൻസ് ഉണ്ടായിരുന്നു. വളരെ നല്ല ടീച്ചർ നല്ല ഗംഭീരാക്കി തന്നു കേട്ടോ. വളരെ നന്ദിയുണ്ട്.
താങ്ക് യു.
ടീച്ചറിന്റെ കോണ്ടാക്ട് നമ്പർ ഇങ്ങനെ ചോദിച്ചിട്ടുണ്ടെന്ന് തോന്നുന്നു കേട്ടോ.
ആ ഗ്രൂപ്പിലുണ്ടല്ലോ. കഴിയുമെങ്കിൽ ഗ്രൂപ്പ് മെസ്സേജസ് അയക്കുമായിരുന്നെങ്കിൽ ഉപകാരമായിരുന്നു, പേഴ്സണൽ മെസ്സേജസിനെ കഴി.
ശരി ടീച്ചറെ, പറയാം.
മാഡം ഈ മെറ്റീരിയൽ ഷെയർ ചെയ്യാൻ പറ്റും മാഡം?
മെറ്റീരിയൽ ഷെയർ ചെയ്യാം.
കാരണം കുറെ ഡോക്ടേഴ്സിന്റെ ഇതിനകത്ത് സൂമിൽ എൻട്രി ചെയ്യാൻ പറ്റിയില്ല.
ആണോ? യൂട്യൂബ് ലിങ്ക് പോകുന്നില്ലേ?
യൂട്യൂബ് ലിങ്ക് പോകുന്നുണ്ട്. ഓക്കെ, അത് എടുക്കാൻ പറയാം.
റെക്കോർഡിംഗ് വീഡിയോ ഉണ്ട് ടീച്ചറെ.
ഓക്കെ
ഓക്കെ ശരി
ടീച്ചറെ.
ബൈ. ഗുഡ് നൈറ്റ്.
ഗുഡ് നൈറ്റ് ടീച്ചർ.
ഓക്കെ മാഡം, താങ്ക് യു.
താങ്ക് യു.